tell you a bit about Powys Teaching Health Board. I may be biased here, but I think it's one of the most beautiful parts of Wales, and you may well already know a couple of facts. Powys Teaching Health Board covers 1/4 of the landmass of Wales, so we're 25% of Wales. We've only got 4% of the people, which makes us one of the most rural health boards and health service areas in all of England and Wales, actually. And apparently we've got more sheep than people, so that may not be a surprise to many of you, but it's a fact. The other thing that I think is quite interesting in our geography is that to get from north to south is the same distance as going from the Severn Bridge in Bristol right the way through to the Chiswick flyover in London. I use that fact to just try to share with people the vastness of the environment, really. Now, we are one of 7 health boards, integrated health boards in Wales, and we're the largest, but we're also the smallest in terms of population and money. And we enjoy a really unique position because we both work into England and we work in Wales, because we don't have any district general hospitals of our own. We buy services from other organisations, both in England and in Wales, and so we work really closely with a whole host of different partners right the way through Wales and on the border of England. So partnership is really key. The ability to work together and work collaboratively is really important as well. So then just a couple of other facts. About half of the money we have in the organisation is spent on buying services from other people, other organisations. Most of those are secondary care type services, so district general hospital, or even specialist services, things like heart transplants. We also buy ambulance services, and we're part of a 7-way club on that across Wales. About 25% of our budget, about a quarter of our budget, is spent in primary care. And we've got a primary care service in Powys that we can be really proud of. And that's made up of general practice, so the doctors, the GP services that we use, optometrists, so eye care, pharmacy and dental services. They all make up primary care. So that leaves about a quarter of our budget being spent on directly provided services, and of course we see those most prominently in our community hospitals and our community teams. But we also have visiting consultants coming into the patch so that people can have their care closer to home, and I think that feels exactly the type of service we want to continue to develop. And our members of the public, stakeholders have told us really clearly they love to have more care closer to home. So that's one of our ambitions as we move forward. This session always gives me a chance to talk about our strategy. Our strategy really is, so what is it that we're here to do over the next few, and in fact 10 years of our health and care strategy. We were the first area in Wales to develop a health and social care strategy, and I think that's something we continue to be really proud of. It's called A Healthy Caring Powys. And I think that's a very simple message to give out to the public and also to bodies such as Welsh Government, because we're here to try to develop a Powys that is both healthy and caring. There's a couple of things that I'd flag for our strategy, and that's our principles. Hopefully you get a chance to have a look at the strategy and you'll see that we're about doing things that matter to people, things that work, focusing on those in greatest need, really being quite prudent in how we use our resources and our talents, and working closely and in partnership with people and communities. So there are a couple of our principles. But what we're trying to achieve is a greater focus on well-being. So we're not a national ill health service, we're a national health service. So focusing on well-being is really, really important, and we know that will make a difference to our health and well-being more generally. offering early help and support for those who need it, that hopefully looks to prevent people escalating into more intensive care and support. We want to tackle the big 4 diseases that limit life, and that's mental health issues, cancer, respiratory issues, and cardiovascular issues. And then finally, we want to do this in a really joined up way. We worked with about 10,000 people actually contributed in one way or another to the strategy development. And these were the really key messages that they told us. And in particular, they told us about joined up care. They also mentioned care closer to home. So in all of our thinking, we are trying to bring back as close to home as possible the services that we can provide safely. And so only enabling people to have to travel where there's a real need. And we'll do that through a number of different means. So workforce is critical, and you yourselves joining the organisation are key in helping us to achieve that. So our focus on workforce is very important, as is actually really engaging with digital. And some of us perhaps grew up in an era where digital wasn't always sort of the central theme, but we're all having to learn and adapt to new ways of working. Many of us do our banking online and our shopping online now, and healthcare is moving in that way as well, and so there's something for us to embrace together on that. Innovative environments, you may see around you that some of our buildings are quite old. Many of them predate even the NHS back in 1948, and so we are working really hard to provide more up-to-date environments of care, and also to focus on our research and development and innovation. And then finally, and this is probably one of the big features for Powys, is that we are transforming, we plan to transform our services in partnership with people. So with yourselves as colleagues, with our stakeholders and our partners in other organisations, and importantly with the people of Powys, because after all it is our collective NHS here in Powys, and we all have a stake in it. So I hope that you will find the strategy is exciting, clear, visual, and will help you to guide your work. And thank you in advance for your part in helping us to make it happen.